Item number 4, AB1117, Christina Garcia. Medi-Cal vaccination rates. Good afternoon, Assembly Member, and please proceed.
Good afternoon. AB 1117 would bring additional resources to the stretched Medi-Cal system to help improve California's vaccination rates for 2-year-olds. It would create the California Childhood Immunization Quality Improvement Fund, which would be funded by voluntary contributions from Medi-Cal managed care organizations and matched by an equal amount of federal funds. Experience in other states, New York, Louisiana, and Maine, demonstrate that targeted administrative support and financial incentives can result in improved immunization rates for children in Medicaid. AB 1117 aims to bring more resources to help Medi-Cal plans and pediatricians ensure that preventive care is provided for our youngest Californians. With me today is Kelly Hardy with Children Now, who will give a brief testimony and is available to answer any technical questions.
Thank you. Kelly Hardy with Children Now. This bill is necessary because the Department of Health Care Services reported that in 2013, nearly 40,000 2-year-olds in Medi-Cal managed care were not fully vaccinated. And the early years are a particularly vulnerable time with developing immune systems, so we really need to focus the system more on getting kids immunized early on. We're very pleased to work with committee staff on some of the issues around the bill, and I'm here if you have any questions. Thank you.
What was the percentage again? I didn't hear that. At the beginning you said?
It's around 78%, but 40,000 2-year-olds were not fully vaccinated in 2013.
Thank you.
Kathy Dressler from the Children's Partnership in support, also speaking on behalf of our Children's Health Coverage Coalition, which includes Children Now, TCP, the United Way, PICO California, Children's Defense Fund, and the CCHI, California Children's Health Initiatives.
Laura Fitzgerald on behalf of the California Life Sciences Association, formerly known as CHI and Bay Bio, in support as well.
Lydia Bourne representing American Academy of Pediatrics in support.
Bernadette Ariano on behalf of the California Children's Hospital Association in support.
And Sawait Seam on behalf of Health Access in support.
Kelly Brooks on behalf of the Association of California Healthcare Districts here in support.
Thank you. Anyone else in support?
Justin Garrett with the March of Dimes in support.
Thank you. Opposition? Questions, comments from any of the members? Tell me, Assembly Member, a little bit about the mechanism for reimbursement and the incentives, because I've just got a couple questions on that.
I'm going to refer to Kelly to answer that.
Sure. So 2/3 of the funds would go to the managed care plans, and it would be based on a reward, really, for each 2-year-old that's fully vaccinated. So it's just based purely on numbers of vaccinated 2-year-olds. 2/3 would go to the managed care companies. 1/3 would go to DHCS to use in support and technical assistance in helping providers develop ways to better track immunizations.
I think they have some opposition.
Does that answer the question?
Yeah, and I'm just trying to figure, I know the mix, the percentage was based on other states, I believe, but I'm just wondering if that's enough, and I'm not suggesting a change, but if that's enough incentive to get the patient to actually come in and, more importantly, get the vaccination. It seemed like if it was more geared towards the provider, when the child is in the chair, the provider is more likely to have an incentive to encourage the vaccination. I'm just trying to figure out if the mix is going to help at all with increasing that rate at all. I'm just questioning.
Sure. There is a pass-through to providers from the 2/3 that goes to Medi-Cal managed care companies. And from the research that we've done, we think that that will be enough, along with the patient reminders and the other technical assistance that will be in place.
Okay. Are they here? Support? Okay. This is opposition?
Yes.
Okay. Please state your name and position, and then you have a total of 6 minutes in total.
Hello, everyone. My name is Joshua Coleman, and this is my son, Otto Coleman. Otto was in a wheelchair because he suffers from vaccine-induced transverse myelitis, so he's paralyzed from the waist down. Vaccine injury is a real thing, and it's not as rare as many people think. When my wife was pregnant with Otto, we had the discussion of should we vaccinate? Should we space them out? We knew very little about vaccines and ultimately decided to do what our doctor recommended. After Otto's vaccine injury at 17 months old, we thought about how we did not receive thorough informed consent from our doctor. Our pediatrician did not ask about our family's health history. He didn't ask if Otto, my wife, or I were allergic to any of the ingredients in the multiple vaccines he would be receiving. He did not review each and every package insert with us, including contraindications, possible side effects, etc., and didn't show us the vaccine inserts for us to read on our own. Parents not receiving proper informed consent in regards to vaccinating is a problem. Do I believe that some pediatricians do give proper informed consent? Yes, but not all. This bill gives financial incentives to Medi-Cal doctors when they have their patients' babies fully vaccinated by 2 years old. So the bill wants doctors to do something differently to increase the amount of vaccines at a younger age. I am extremely worried that some doctors may accomplish this by giving less informed consent. I want to humbly ask for some amendments so that we can be sure that this bill will not result in parents receiving less informed consent. I hope that all of you would agree that informed consent is crucial and we need to protect it, especially when offering this kind of financial incentive. Number one, parents should be aware of this incentive. They should be told that the doctor is receiving a financial bonus for every patient they get fully vaccinated by 2 years old. They should know about this influence. That is part of them being able to make an informed decision. I don't think it's enough for doctors to be told to do this. I think that they need to have something printed out informing the patient's parent or guardian about this incentive that they have to sign. And of course, this would have to be available in different languages to accommodate everyone. And we would love to work with the authors on this. Number two, the doctor should have to give the vaccine inserts to the patient's parent or guardian before any vaccine is administered. And again, I would like them to have to sign to acknowledge that they received the inserts. Perhaps this paperwork could be combined with the previous one I asked for, which would inform the parent or guardian of the doctor's bonus. Kill two birds with one stone. Number three, I am very, very worried that this bill will discourage doctors from giving out a medical exemption for vaccines when it is needed. That is a scary thought. And a doctor knowing they will receive less money if they give a medical exemption is a frightening conflict of interest. So I would like to ask for another amendment saying that doctors will automatically receive the same bonus for a patient who has or is given a medical exemption from vaccines. We cannot have an incentive for a doctor to not give a patient a needed medical exemption. These amendments would absolutely ensure an increase of informed consent, which is in grave danger if this bill passes without them. Please add these, and we would love to work with the author on these.
Good afternoon. State your name, please.
I'm Dr. Mary Kelly Sutton, and I'm requesting a two-word amendment. One of the restrictions on my PC professional corporation is that ownership is restricted to members of a certain profession. This restricts me from sharing business goals with a non-doctor because the practice of medicine should not be unduly influenced by anything other than the professional goals of patient care. As currently written, AB1117 associates a medical act, the vaccination administration, with a monetary reward. This treats medicine as though it is a retail activity, not a profession, and writes a kickback into the practice of medicine, despite this alliance being illegal in other settings, such as in my professional corporation. For some citizens, this brings up the fear that doctors will deny seeing babies that aren't vaccinated on schedule because it will interfere with the doctor receiving his or her bonus. For doctors, this bill places the profession in a demeaning position by turning the act of giving a vaccine into retail. A two-word amendment to the existing language would preserve the doctor's role as a professional and preserve and strengthen the doctor-patient relationship. The two words would be consideration of, and they would be added in section C1, and I'll read the portion that's relevant. $125 for each enrollee who receives consideration of all recommended vaccinations by the time he or she reaches 2 years of age. This change attaches the monetary incentive to a truly professional activity, namely, collecting information and making an individual judgment related to the individual patient. Phrased this way, clinics supporting the underserved still receive the extra compensation they need, but the consideration of vaccine status becomes primary, not the act of vaccination. A simple checklist of 6 items at each of the well-child visits in the first 2 years could provide documentation that this professional encounter has occurred as a basis for the monetary reward. In this way, AB 1117 would support the exercise of professional information gathering and judgment, but would not dictate a medical act, which can only be rightly ordered by a trained healthcare provider, not by a universal law. If AB 1117 is not changed to support a professional role by the physician, then each parent must be informed that the vaccine discussion they are about to partake in with his or her doctor has a monetary reward for the physician, depending on outcome. Looking at the larger picture of vaccines in general, it's important to note that a group of 200-plus physicians has signed a statement opposing mandated vaccines because of concerns with safety and effectiveness questions around vaccines. I have listed in the material that you'll receive the 6 checklist items that could be easily implemented. Thank you.
And we have run out of time, so anyone else remaining, just please state your name and position, please.
Hi, my name is Terry Rourke. I'm a native Californian and surviving parent of a vaccine-injured child. On behalf of the California Coalition for Vaccine Choice in alliance with the National Vaccine Information Center, we oppose this bill.
Thank you.
On behalf of Your Family, Your Choice, a California Coalition, we oppose this bill.
Thank you.
My name is Michelle Treiner, and on behalf of hundreds of families in East Contra Costa County, we oppose this bill. Thank you.
Thank you. So, receiving all the information today, we usually try to do an analysis on it, so it's difficult for us to implement here in this committee. If you are interested, if the author is interested, maybe you can work with her between now and the next committee. It's going to go into appropriations. So we can't analyze what you had given to us, but that might be a suggestion. And it would be totally up to the author at a future time if she'd be willing to work with you. Any questions from any of the members? Any comments?
Mr. Roth.
Yes, Senator Roth.
Thank you, Mr. Chair. One of the points that was made had to do with the medical exemption. We've spent a lot of time on vaccines in this building lately. One of the concerns, at least, that I have, and I believe it's shared by some, if not many of my colleagues, is that the medical exemption be fully utilized and implemented where appropriate. One of my concerns has to do with the reward payment being made for those who have been vaccinated, but not for those for whom a medical exemption was granted. Would there be any impediment to restructuring this bill to include a reward payment to plans not only for those young people who are vaccinated, but also including those for whom a medical exemption was deemed appropriate?
I want to thank Mr. Coleman and his family for coming out here and the physician that came out. I think they brought up some valid points that I'm more than willing to look into. I think this idea of a profession that's not retail is important, and we want to respect that. In addition to the informed consent, proper informed consent, I think are things that I'm willing to look into. I don't have an analysis of how this would all be impacted and how we find that sweet spot, but I think their points are very valid, and my goal is to create something that's better for everyone involved. And so I do appreciate that input, and I'm fully committed to trying to figure out if it's that or something else, but how do we get at respecting the professionalism and the informed consent piece?
Well, and the reason I asked the question is we spent a fair amount of time listening to testimony from parents talking about the difficulty in obtaining a medical exemption from a physician. And I, for one, ask questions on that subject. I know many of my colleagues ask similar questions on this side and the other side of the building on that subject. And so I would certainly not interested in doing anything to disincentivize healthcare providers from issuing a medical exemption in appropriate cases. And I want them to pay attention to the issues, to follow their oath, and where there is any suggestion that a medical exemption is appropriate, to issue it. And so I'm a little concerned about I hate to use the word one-sided because that's usually used in a negative way, and I don't mean to be negative, but I'm a little concerned about the fact that the payment flows in one direction but not in the other. So while I will support the bill today, I would certainly ask that you take a look at that, because I am personally committed to making sure that this medical exemption thing works.
You have my commitment to definitely take this into serious consideration, and we respect that, and we make it easier for that process to work, actually.
Thank you,
I do appreciate these concerns, and I think that they merit our attention.
Thank you. Thank you, Mr. Chair.
Thank you. Any other questions from any of the members? Seeing no questions. So what was the young man's name again? What was your name?
Otto.
And how old are you?
6.
6. What grade are you in?
First grade.
First grade. Good job. Thanks for being here. All right.
Otto.
Thank you.
And math is your favorite subject, right?
Okay, seeing no other questions, is there a motion? It was moved by, my apologies, I think Senator Roth moved it earlier, I apologize. Moved by Senator Roth. This is item number 4, AB1117, due pass appropriations. Chair is recommending support. Call the members, please.
Hernandez?
Aye.
Hernandez, aye. Nguyen? No. Nguyen, no. Hall? Mitchell? Monning? Aye. Monning, aye. Nielsen? Pan? Roth? Roth, aye. 3-1.
Current vote count is 3-1. We're going to place that bill on call.
Thank you.